Hi everybody, so we're going to be talking about nursing history and nursing's image, our public perception and stereotypes. It's important to know these things because, as it says here, knowing where we come from helps us understand where we're going. Normally when we work in class, obviously we're able to interact a little bit with some of these questions, so these are a little bit more of rhetorical questions and I'll be able to sort of answer them as I'm talking with you. We can certainly talk about them as part of the discussion post this week. But mostly I wanted everyone to be able to post a little bit about themselves personally. You can post a picture. Hopefully from the orientation videos that I gave you this summer, you'll be able to change your avatar to have a little picture of yourself as well. So the first thing is, what does history have to do with it? So if I asked you to name a historical figure in nursing that you like and why, most people from the community colleges don't usually have a nursing history class. And so you might know, well, everybody would know Florence Nightingale. So usually that's the first one to come up here. Some people might know Clara Barton. They might know Dorothea Dix. They might know Margaret Sanger. Margaret Sanger is one of the people that helped to invent birth control, the birth control pill specifically. That was Margaret Sanger. Clara Barton started the American Red Cross. So just some people to think about, but when we think about people that are known for nursing, including Florence Nightingale, who I have sort of a love-hate relationship with, we look at they're all affluent, very well-educated, white women and Christian. So what happened to everybody else? Where did they go? And so I wanted, my next question, which you should probably guess the answer, is what do Harriet Tubman, Walt Whitman, and Susie Walkingbear Yellowtail all have in common? They're all also nurses, but they're not people that we know of as nurses. We don't think of Harriet Tubman, we think of her as being a part of the Underground Railroad. We think of Walt Whitman as being the poet. Most people don't know the name Susie Walkingbear Yellowtail, but they're all nurses. Harriet Tubman, although she was a part of the Underground Railroad, she was also a spy for the North. Because she was a black woman, she was able to walk right into the Southern camps and tell them that she was there to be a nurse for the Southern black men who were fighting for the South. And they were like, okay, cool. And so she would walk right in and she would take care of people. But while she was taking care of them, she would also say, look, I'm from the North. Tell me where you're going to go next. And then I can prepare them and tell them where we're going to be. And they would tell her because that was the goal. And then she would walk right back out and no one thought anything of it. So they didn't give her enough credit. They didn't take her cautiously enough, and they should have. So she had a big role in that because of where she was able to sort of come in and out of. She was also able to lead the Combahee River initiative, which makes her actually the first not only woman, but also the first African-American woman to lead a military initiative. And so she led that, and there's actually a black feminist group called the Combahee River Collective. Walt Whitman was also a part of, he was a war nurse, and Susie Walkingbear Yellowtail is not only a nurse for Native Americans, but has done a lot of advocacy and has come up with a nursing theory, a concept about nursing, which we'll talk all about actually in Fall B. You'll have that class with me as well. And so she has one that specifically reflects Native American spirituality and philosophy. So why does any of this matter? Well, if we start talking about the history of nursing, so this is Flo, as most of us know her. She's delightful. But when we start talking about the history of nursing, we don't think of this woman over here who was Mary Seacole. She was a Caribbean nurse and very famous. They used to say that she was the doctor of the land. She had cured cholera in the Caribbean. And when Florence Nightingale put out the initiative to have more people come from all over the world to help in Crimea, she had said, oh, sure, I'll volunteer, I'll do it. And Florence Nightingale said no, even though she was famous for ending cholera, was an excellent nurse, had an excellent reputation, a national figure. She said no. And so we have to talk about why. We have to talk about this history of marginalization. And so we have this long history of marginalizing the importance of different groups of people. I could probably teach an entire class about all the different kinds of people that are in nursing and what they've done from a historical perspective. The first nurse to ever set foot in the United States was actually both male and Latino. And again, that's not something that we ever talk about. we sort of skip over all of those things and we really present this one image. And the reason is that Florence Nightingale really wanted to set the right image for nursing. She didn't like, so you can't tell because it's a black and white picture, but you see she's got these cute little curly things in her hair. She had all kinds of ribbons and colorful clothes, short sleeves and open collar. That's because it's hot in the Caribbean. And that was not the way that Florence Nightingale did it, especially with a different upbringing of being very sort of cloistered, or her Christian upbringing and being from an affluent family in England at the time. And so Florence Nightingale was on one hand trying to change the image of nursing so that we could move away from stereotypes that we were mostly just prostitutes and uneducated people. And that came because most people who came from circumstances like Florence, their parents wouldn't let them be nurses because they had to see naked men. And so if they weren't married yet, you can't see any naked men other than your husband. And then once you are married, the only naked man you should be seeing is your husband. So that was, she was really trying to change what that image was, but that also meant marginalizing other people who didn't look the way that she wanted them to look. Some examples of how this has played out is that during the Civil War, that war benefits excluded nurses who also worked as a cook or a laundress. And so pretty much all the black nurses that worked during the Civil War also double dipped and also did cooking and also cleaned the laundry. And so any of those that also took care of the patients did not receive any wartime benefits because they were basically excluding that group of people. Educational and occupational segregation. So in nursing, we see this in more than any other healthcare profession. There's the Sullivan Report, which came out in 2010 and went through all the different health professions. Nursing was the number one in terms of being the least diversified. And by all groups, by race, class, gender, sexual orientation, physical ability, religion, everything. We are 10%, all of those groups and everything else is pretty much 90% one type of nurse. White, middle class, able-bodied, heterosexual, Christian. I'm trying to see if I forgot one. I don't know. I forget when you know that it's in there, but you get the idea. And so looking on the opposite side of that, so we've had a nursing profession for hundreds of years, and yet we still are only 10%. Now, it is changing slowly but surely, but when you look at medicine, and I mean literally look at medicine, medicine is more than 50% female at this point. It is hugely diverse across religious and racial lines. We see the same thing again in multiple groups for healthcare professions, but we don't see that in nursing. What we see is 90% one thing, and then people who are ancillary staff, secretary, nurse's aide, CNA, etc., are where we see the most diversity in the healthcare profession. And that's wrong and that's sad, and we need to fix that. Okay, so why know your history? So what are the images of nursing when Flo was around? So I just talked about that. The images of nursing during the American Wars, we talked about that. And what was Clara Barton and what does it matter? So Clara Barton, I told you, started the Red Cross. She never went to nursing school. She never took care of patients in a hospital. The only patient that she ever took care of was her brother. And it wasn't until after she started the Red Cross, and she started the Red Cross because that was a humanitarian project that she did as an affluent white woman, which was very common for people to do at the time. And it wasn't until after that, when she started working with the Red Cross, that she went out and helped during wartime efforts. And so eventually she got nursing experience, but she is known as a famous historical nurse, and really under modern definitions is not a nurse at all. Just because you go and help out for humanitarian reasons in a place doesn't make you a nurse. So it's interesting. And so why does this matter? Well, because we were trying to create a particular history, a history full of people that were doing wonderful and important things, and if they could call themselves a nurse, then we adopted it. And it was a part of growing ourselves as a profession, rather than as a vocation or as something that was stereotyped in other ways. And so this was a part of creating this perhaps illusion of what nursing was like, so that we could have more educated, affluent women, especially white women, in nursing, which at the time was the goal. So That's really important. Why not talk about Susie Walking Bear Yellowtail? Why not talk about Harriet Tubman? So I think these are things that are really important. And especially, again, although most of you have not had a nursing history class, I had a nursing history class in my program and we never talked about any of these people. But I also had people that didn't look like me sitting with me in class. And perhaps it would have been good for all of us to have heard about people that were different than the ones that were presented. It would encourage the people who were in the program and also educate the other nurses and create more of a community around our diverse background and our diverse history, which is a wonderful history and really should be celebrated. Okay, so all that being said, don't want this class to be a super duper downer, but these are the things that we need to accept and start talking about, and we're going to talk about a lot of these kind of issues, not just in this class, but in this whole program. So on a positive note, RNs are ranked highest among all professionals for the highest professional standards of honesty and ethics, and that's been true for many years now. We're usually ranked either second or first. Firefighters often we trade places with. And there's 4 areas where the public seeks our advice. This you will see perhaps in the midterm or maybe the final, so keep this in mind. So in other words, if you're sitting on a bus and someone says, oh, you're a nurse, one of the things that people start talking about is what can they do to take care of some problem, or they have something post-op and they want to say, oh, I had surgery but I'm still bleeding, or I still have this ache, or I have a fever, and they start asking you these questions, and this is one of those top 4 areas. Over-the-counter healthcare products, so that would be something that people talk about. What vitamin can I take? Should I take aspirin or Tylenol? Administration and side effects of prescription drugs. So they might ask a nurse and say, oh, well, I started taking this and I don't know if I'm having an allergic reaction. So these are, again, the common questions. And interpreting physician-provided information. So if you're talking to, especially with family members who obviously know you're a nurse because they're your family members, but that may be, someone may say something to you and you say, okay, well, what did the doctor tell you when you left? And they may tell you something and you know that that's not probably at all what they said, that you know that it was being misunderstood. And so helping them understand what the physician or the healthcare provider was trying to explain to them. Okay, so imagery matters. And this is going to be the last slide that we do before I have to end for this particular part of the video, and then we'll go to the next one. So the 4 main stereotypes in nursing are the naughty nurse. So you see that Jessica Rabbit is here representing our sexy nurse. The Angel of Mercy, you see her here providing care to the wounded during wartime. Nurse Ratched is a similar stereotype that we have in nursing. For people who don't know it, it's from the book One Flew Over the Cuckoo's Nest. There was a movie that was made from it, and in it she ran the psych ward and ran it as militantly as she possibly could. No one got away with anything unless she gave approval for it. She was really rough and was really in control in a very bad way, in charge of what was going on. And the last one would be the handmaidens of the doctor. So there's that stereotype that we're just out there doing whatever the doctors tell us to do. They tell us to empty the bedpans and we empty them, and they tell them to give this pill and we give it, rather than really representing our educational background, our experience, that usually the doctors aren't prescribing stuff unless we're encouraging them to do so. We would call them up and say, they have this problem, here's what I would like you to order, and they say, okie dokie. That's very opposite of what the public perception often is. The Angel of Mercy stereotype is really problematic because when we start getting into situations of mandated overtime, or can you take this one more admission, there's sort of this view of course you're going to do it because you are a nice lady, you are a healer and an angel of mercy, and so you will do something that maybe is unsafe in terms of patient care, or that's more than what you should or could do to provide best practice. Clearly the naughty nurse has a problem, and it doesn't mean that everyone hasn't at some point embraced this stereotype. But if you're in the hospital and you're working, nobody wants this to be the stereotype of what the patients or the doctors or anyone else is thinking of you. This is interesting because this was something that was given out by a hospital for Nurses Day. Wouldn't that make you feel appreciated? So I'm going to stop here and then we'll go to the next section.